friends, Dr. Lindsay here. Today I'm going to go over a few exercises for hip pinching while you're doing some squats. So I had this exact same problem yesterday when I was doing my workout, and when I was going down into my squat position and trying to use my glutes to come back up, I was getting a big pinching sensation in my hip. So I wasn't really able to activate my glutes properly, and then I wasn't able to get down as deep as I wanted to in my squat. So I am going to show you a few exercises in order to get rid of that pinching sensation. So the first one we're going to do, well, both of them require an exercise band. I'm just going to move this a little bit closer. So you're going to put your bad hip into the loop and loop it around something heavy that you're hopefully not going to move and slide all over the place. And then I have the band on the inside of my knee, and what we're going to do is go through joint mobilization. So we want the joint of the hip, which is a ball and socket, to be able to move adequately through internal rotation and external rotation with resistance. So what I'm going to do is start with internal rotation. Oh, and my table is coming along with me, so we're going to go a little bit less. So I'm going to bring my knee towards the center of my body, and you can use your hand for guidance if you need to. Okay, and then we're going to go through this about 10 times or a minute, whichever one you prefer, but at least 10 times. Okay, and then I'm going to move my foot in a little bit closer, so it's more towards the center of my body, so I have more resistance on this band. It's trying to pull my knee outside, or external rotation, so we're going to go into external rotation and bring it back towards the center. So same thing, still working on getting hip mobility through all ranges of motion. Same thing, 10 times, or about 1 minute. Okay, so next we're going to do the same thing, but we're going to have resistance going towards the back of our body. So I have it right in that hip flexor joint, and now we're going to go internal, go about 10 times or so. This is also a good place where you can hold it. You'll probably feel a little stretch on your booty too, out to the side. We're going in and out. After we do that 10 times, then we're going to go external rotation. So having the band pulling on our hip joint will allow for some more space in that hip capsule, so there is more room for my femur bone, or like the hip bone, to move through these ranges of motion. Okay, so we do that about 10 times. And then we can get rid of this band. And then what we want to do as well is get a little bit more activation in our hip and our muscles. So we go into this 90-90 position, and all I'm going to do is raise my knee off the ground and back again. It's only a couple inches, or whatever your range of motion is. So I'm feeling a really good muscle activation in through my hip area, also getting my glutes fired up. So at least 10 times in this position as well. And then we would rotate just for consistency of hip mobilization and activation. Just do the other side as well. And then I'm going to do an isometric contraction of internal rotation. So I'm going to push my knee into the ground and relax. Push it in and relax. If you need a little bit more, you can lift your back foot off the ground and back again. And with that, you may need to stabilize yourself. And the motion, again, only a couple inches, maybe 1 or 2 inches of your foot off the ground. But that's, again, getting some more muscle activation through that hip. And then with hip tightness, that could be an indication that either your obliques, your abs are not activating correctly. It could be glute activation as well. So a really good core activation exercise is the dead bug. And it's super simple. Just lay on our backs. And then we do opposite arm, opposite leg. So you extend out and bring them together. Extend and bring together. And when you're doing this, you want to make sure that your lower back is flat on the floor. So you're really using these really deep core muscles. Not the six-pack abs that you want us to have, but the muscles below that. So you go through 10 times on each side. And then just for a little bit more glute activation, you can do this with or without a band. But what we want to do is pick one leg to stand on, toes, knee, ankle, hip, all in alignment. And then what we do is just tap out and tap in. Tap out and in. And for more resistance, you would add an exercise band. And then you want to do both sides an equal amount of times. 10 times on each side would be great. So that is what I'll be doing for that hip pinching sensation that will help reduce the pain while squatting and also help to get deeper into my squats. So if you have any other questions about hip mobility or hip pain, please send me a message on Instagram at Elite Chiropractic Denver, or you can text me 720-509-9379.